right, there we go, up and running. As Jennifer was mentioning, we have built a digital patient monitoring platform for 5 years, originally from Finland, with 65,000 patients today in 5 different countries. So today I will give you a demo about a prostate cancer patient called Peter who is on hormonal therapy, but also I want to emphasize that we can implement follow-up programs for several other areas. But here I will start with Peter and Peter's home dashboard. So as you can see, Peter has gotten a task from his healthcare staff on the right, and we will start by filling in one of these questionnaires. So quite briefly, these questionnaires are structured, standardized questionnaires. We are an ICHAM technology affiliate, which means that we have these international standardized questionnaires that we can use. And there are for several different type of symptoms and disorders, but I will just briefly fill this in. So as you can see here, for example, these are adaptive, so in case there's pain, we can answer some additional questions on pain. Then we go on. Maybe Peter has had some swelling in his legs, like that. So we go on. No big deal. Just like this, takes a few minutes for the patient to report symptoms and then send in the questionnaire. And as you see here, you instantly get a feedback about the symptoms. In this case, the symptoms were not so severe, so self-care instructions were triggered directly. This is, of course, provided by the hospitals, the clinic, healthcare professionals, not us. But it can automatically be triggered like this. I will show you the dashboard here. For example, Peter can see the symptoms and follow the progress of his disease in a self-educating way. Also, Peter can see the lab values, as we have, in this case, for example, made an integration to the lab, and we can show the PSA value specific for prostate cancer. Of course, this can also be seen on the healthcare professional side, but here's a conversation view. So nurse Nora has given or confirmed the appointment, and Peter can answer, especially cancer patients, they need timely support. And we have seen that our patient reporting and communication platform can decrease amount of calls with up to 75% for nurses in the clinic. Then I will show you real quick the healthcare staff view, which is this, and just like that, we have gotten the 2 different actions that we just got, and the questionnaire, for example, can be assigned to a doctor like this. We can go and have a look at the message, but let's say that now we just mark it as done, as we know what the message says. So if we refresh, the task board will get cleaned up. Like this. So this is a task management view for the healthcare staff to be able to get a decision support, see the different tasks in a real-time manner. That is everything for now. Please come and talk to me afterwards.
Thank you. So you've been active you're active in countries all over Europe, as I understand it.
Yeah.
What sort of feedback do you get from the users?
Right. So we are active in Finland, Germany, Switzerland, Italy, and Sweden, and established in Finland especially, where we started off 5 years ago. But for a patient, we have started with very much a patient-first view, and patients love this. 90% of the patients are actually filling in the questionnaires. 95% of cancer patients feel like this is having a positive impact on their treatment.
Okay. You have questions on that? Marianne?
I do. What party, patient or healthcare professional or healthcare provider, payer, is most anxious to get this once that they've started using it? Who loves it the most?
The patients definitely love it the most, but the staff, when they do, they definitely see the benefit. But like any healthcare product, it's about implementation, especially in this field of patient-reported outcomes, where we bring in a new process. It's been very much implementation. We have implemented this to over 30 hospitals, so our experience in implementation is actually quite unique on a European standard, and this experience is very important to actually get the staff to use this. And that is when they do, they love it, but it takes some time to get them there, right?
Okay. Yeah. Andreas?
Yeah, so very impressive user compliance figures. So my question is, do you intend to use the data, because you gather a lot of data, you tend to use it in some constructive or good manner?
Yes, the data can be used in an anonymized, aggregated way, but owned by the hospital and the clinic. So we are applying machine learning and artificial intelligence to take it to the next phase, perhaps, if we say so.
Okay, I'm going to go ahead. Thank you. I'm going to go ahead and welcome the next team up on stage to rig up. But I have to ask you, Niklas, one thing. You are a customer success manager. What is that?
That's everything from sales to customer success, which means the whole contact with customers, future and existing.
A lot of work. Okay, thank you.